Namaste. Welcome to day one of the Raj Yogi Power of Breath Foundations, Tridosha Balancing 7. This is the seventh course. We've been running a course almost every month or every 2 months. This one is a little delayed though, but we try to offer this course closer to a month, repeat it every month because there are a lot of people who have difficulty with their breathing, etc. And many people have asthma and COPD, ILD, and other breath related issues that they know about. The other thing is because of pollution and lifestyle issues, there is a buildup of phlegm in many people's bodies. They may not be aware of it, but the lung capacity becomes challenged or the lung capacity reduces. When the lung capacity reduces, it means the breath is not doing what it can. So the idea is to learn techniques that will help expel whatever phlegm is there, number one, so that the breathing improves. And number two, to increase the lung capacity with some very interesting but simple exercises and so on. We start this course with belly breathing. Are you all familiar with belly breathing? Are you familiar with belly breathing? Are you doing your belly breathing?
Heard of it? Yes, they say breathe deeply till navel. So,
Okay, okay.
are we doing it
So
exactly right or wrong? That's, I don't know, but we are trying to breathe till belly.
So in the I think you're in the group. So I've shared a link to a YouTube video which explains in detail why belly breathing is important and how it should be done. I'll go over that again little briefly, but I'll show the importance of belly breathing. See, when a newborn baby is born, or when a baby is born, when it's still an infant, and when the baby is lying on a bed, you will notice every time the baby breathes, its belly moves out, and when it breathes out, its belly moves in. So there is a constant rise and fall in the belly only. Have you noticed?
Yes.
Yeah, very good. I trust the others may have also. So, this belly breathing is the natural way of breathing, and that's how, in a sense, Mother Nature taught the baby to breathe. It's not like the mother tells the baby, breathe like this, and then the baby breathes like that. It's not that. It's automatic. Now, why is it important? This is the natural way of breathing, and it usually happens, of course, in infancy and also in early childhood before stress starts building in our system. When stress starts building in the system, we feel a certain tightness in the belly area. This is the diaphragm. The diaphragm tends to stiffen up, tighten, and when the diaphragm tightens, it stops the lungs from expanding fully. Belly breathing is a technique where your diaphragm becomes relaxed. Therefore, when you breathe, your lungs expand. They push on the diaphragm, which pushes on the internal organs in the belly area, and therefore the belly tends to move outward. That's basically the thing that happens when we belly breathe. And it's important, like I said, because it helps you to stay relaxed. Staying relaxed is very important. We have many different organs in the body: heart, lungs, uh, liver, pancreas, etc., etc. So many different organs. All the organs need to function well for our health to be good. Organs can only function well when the systems that carry whatever they carry into these organs. So there is what is called the vascular system. You've heard the term cardiovascular. Cardiovascular refers to the system that brings blood into the lung, into the heart, and pumps the blood from the heart throughout the body. That's the cardiovascular system, but that's not the only vascular system. There are systems that carry, for example, your lymphatic fluid. Lymphatic fluid is what helps the body to fight ailments or any kind of attacks on the body, etc. So the body's natural way of dealing with any kind of illness, etc. So the lymphatic system needs to function well. The reproductive system, the respiratory system, all of them have to function well if the body is to be healthy. Whenever there is any stress in the body, there is a thing called vasoconstriction. That means the vessels tend to become narrow. They become narrowed down. So therefore, the heart has to, you know, beat harder or work harder, and so on. Similarly, in the that which needs to come into all the organs doesn't come so easily, and that which needs to come out doesn't come out so easily. So we have issues, for example, like constipation or numerous other conditions because the vascular system is not functioning well. And therefore, when the different organs are not getting what they want and the toxins are not released from the body the way they should be, then illness begins to take root. Once illness begins to take root, we may take medicines, medication, etc. for specific medicines, but they may cure one thing. Chances are they will hurt in some other way. So ideally, if we are able to live our lives without being over dependent on medication, we will be healthier overall. So basically, the more we can learn to be relaxed, the more, the better the systems will function. There are two systems in the body, part of the nervous system. One is called the sympathetic nervous system, the other is called the parasympathetic nervous system. If one works, the other doesn't. When the other works, the first doesn't. The sympathetic nervous system it plays an important role. It's essential when there is any threat to our bodies, to our lives, to us, and so on. That's when we need to be in the sympathetic nervous system so that the body can take corrective action or do something to protect itself. So the sympathetic nervous system plays an important role there. But if we are always in the sympathetic nervous system, then the parasympathetic nervous system becomes not so active. If the parasympathetic nervous system is not active, that means the body is not able to heal itself, repair itself, and so on. It cannot function well. So belly breathing is a very easy, very simple, very natural technique which automatically brings the system into the parasympathetic zone. When belly breathing is happening, you are relaxed and the parasympathetic nervous system is more in function. When the parasympathetic nervous system is functioning, the vasoconstriction that happens also reduces. So there may actually be some vasodilation. Now,
Hmm.
when we are young and we are not so stressed, etc., and the flow of all the things in the body happens well. So you don't find children suffering from serious ailments, usually. Of course, there could be because of genetic reasons or environmental reasons or whatever, I don't know. But usually, as we grow older, different kinds of illnesses begin to take root in our body. नीलम जी, आप कुछ बोलना चाह रहे हैं?
You used a particular term called vaso.
Dilation and vasoconstriction.
Can you explain what
Constrict,
is that?
I did actually before you came. Anyway, I'll do it again.
Sorry.
So the bodies have different kinds of organs, right? Heart, lungs, brain, kidneys, liver, pancreas, etc., etc., right? All these organs have to function well for the body to also be in a good shape, in good health. How can they function well if what is needed by them doesn't come to them easily? And the waste from these organs does not leave easily. So there are systems that bring in what is needed by these organs, and there are systems that expel that which is not needed by these organs, which is the vascular system. Like we have the cardiovascular system. So this vascular system is spread throughout the body to the organs and to, of course, other parts of the body. They may be In Sanatan Dharma, in Hinduism, we have this term called nadis. Nadis are subtle channels through which energy flows. Now, when we say these subtle channels through which energy flows, it could be just plain energy, or it could also be all these different things that have to be brought. For example, the blood has to flow to each part of the body, including right down to the tips of the fingers, etc. Blood has to flow there. So if you cut your fingertip little, a little blood will come out, you will notice. For example, when a doctor or a medical person takes your blood, he just pricks your one part of your finger, and a drop or two of blood comes out, which he uses to collect a sample and so on. So these flows have to be good. Now, in the vascular system, it's like the major part, the main vascular system may be a little broader, a little thicker, a little wider, and so on. But as it branches out, they become smaller, thinner, and subtler, and so on. If there is any kind of blockage, for example, some people feel a certain numbness, for example, or tingling sensation in the fingers. That means the vascular system is not functioning well. That's why you have this tingling kind of sensation, because the flows in the body are not happening very well. So whenever we are stressed, we create pressure on our systems, and therefore, uh, or rather, a thing called vasoconstriction happens. That means these channels become narrower. If they constrict, that means the flows are not as good as they can be, as they should be. And just as when you are stressed, you may have noticed whenever you are angry or upset or something, you will feel a certain tightness in your body. You have no conscious control over it generally, but you can get it. But you have this as a natural reaction by the body, in the body. And when this stress builds up, it puts pressure on all these different vascular systems, including the cardiovascular system. And whenever there is stress, and they tend to narrow, etc., lot of damage can start happening to the body over time. Maybe not in a day, maybe not in a month, maybe not even in a couple of years, but over an extended period of time, the stress and the constriction will lead to different kinds of ailments. It depends on an individual. Each individual is different. They may suffer in their own special way. Some common ailments, for example, constipation. If the flows in the body are not happening well, constipation is obvious. It will happen. But if the flows in your body are happening well, there will be no constipation. Then there are conditions such as backaches, fibromyalgia, sciatica, etc. In many ways, these are because there is a blockage somewhere in the body, and this blockage happens because the vascular system narrows, or there is something impeding the flow of energy and whatever else is flowing through the body, and it creates all these kinds of challenges in the body. So when we learn to stay relaxed, at least we make sure that there is no additional pressure on the systems that are working inside us. So belly breathing is a foundation breath, which is why I've been sharing the belly breathing link to the belly breathing video so that everyone can watch it and start practicing belly breathing. Are you doing it? Are you all doing it? Are you all practicing belly
Yes.
breathing? Now, when we say we are practicing belly breathing, it doesn't mean that we do it for 10 minutes and the rest of the day it's gone.
Hmm.
No. So belly breathing should be our default breath. That means it should happen all the time. If you observe how you are breathing, and if you bring your attention to it, you will notice when you are breathing in, your belly moves out gently. When you're breathing out, your belly moves in. It's not a question of doing it. It should happen on its own. If you try to do it, you will not get the same results. You may get the belly to move out and in. That's another matter. But that's not the way it should function. It should just happen. I've explained that in the video in more detail. I've also shared a very simple technique. If you lie down on your back and if you pull your heels to your buttocks, hold that position with your knees pointing to the ceiling. If you hold that posture for a few minutes, automatically belly breathing will start happening. You will also find when you do that, your body feels relaxed and you may even feel drowsy, etc., because there is a level of relaxation in the body. So when that happens, observe how belly breathing is happening and let that same belly breathing happen, not doing it. It's important. I'm stressing on this. You don't have to do it. You have to let it happen. So when your attention goes to your breath, observe it and see if belly breathing is happening. If it's happening, wonderful. You can pat yourself on the back and continue doing it. You'll do it for 10, 15, 20 days, and slowly this will become your normal way of breathing. It will become your default breath. When belly breathing becomes your default breath, belly breathing itself will help your body to deal with many different ailments, etc. And slowly, many of these ailments will automatically disappear. Constipation is a good example. If you suffer from constipation, if you allow belly breathing to happen in your body, you will find over a few days or weeks, you will notice that your constipation problem has reduced fairly substantially. So, let belly breathing be your foundation breath. So, once again, are we all practicing belly breathing? Give me a thumbs up to show me that you are, because you've not turned on your video, so I can't see.
May I ask a question in the interim?
Yes, yes.
You
Thank
said
you,
if you're
Anubhav.
consciously doing it, that's not practicing it. So how do we ensure that it becomes our by default breathing?
Yes. So, just as I said, when you lie down on your back and you point your knees to the ceiling, bring your heels to the buttocks, hold that posture, automatically belly breathing will begin
Have,
to happen.
have you
Just
shared that
observe that.
motion? Have you shared
I've
that
shared
motion?
that in the video. I've shared that video already. I've shared it repeatedly and asked everyone to do it, but I don't know if you've noticed it or not, or watched it or not. If you like, you can go back and take a look, watch the video, because I've gone in detail and explained it. So I don't want to spend more time doing the same thing now. So belly breathing is a foundation breath. Now we come to the Tridosha balancing, which aims, at least the first part, the basic course, aims, oh, sorry, the basic part aims to show you some simple breathing techniques, etc., to help you release any phlegm in your respiratory system. I'm not talking about phlegm in the whole body, etc., because phlegm can be in many different parts of the body. It keeps the body keeps producing phlegm because some people's bodies are prone to that. They have a characteristic that they tend to produce more phlegm. But some people's bodies don't produce so much phlegm, though there is some amount of phlegm that is there in everyone's bodies, and whether we like it or not, it will stay there. It will stay in the body somewhere. And if too much of it starts collecting, especially in the respiratory system, it will interfere with the quality of our breath. Now, breath or breathing is the single most important thing that we do in life. Life, in a sense, begins with the first breath, it ends with the last breath. If we can breathe better during the period that we are living alive, the quality of our life will improve in many obvious and less obvious ways. It's a What breath does to us is beyond our imagination. It brings us so much. Now, we can't change the environment. Environment is what it is. If there is some pollution in the environment, so be it. But if you smoke, which I did, for example, and I did it for a very long time, I damaged myself. And partly because of that, partly because of other conditions, maybe, I had a condition called COPD. COPD means chronic obstructive pulmonary lungs disease. Chronic obstructive pulmonary disease. Chronic means something that lasts for a long time. Obstructive, that means there are obstructions in the system. Pulmonary, like I said, has to do with the lungs. If there is obstruction, it will interfere with the quality of our breath naturally. And things like smoking, etc., they are very harmful. Or being in an environment where there is a lot of pollution or particulate matter, etc., all that can disturb. But sometimes we can't do much about it. It is what it is. We can't change the environment, but at least we can change the environment around us, or we can make sure we don't cause it further harm. We don't make it worse. So that's important. We must avoid smoking if we can. I smoked for 40 years. I damaged myself a lot. And luckily for me, I was always connected with breath to some degree or the other, even when I was smoking. So I always had this feeling that I need to give up smoking, but it's very difficult to give it up because that's how bad habits are. When we create a bad habit, it becomes, a constant companion. Very, very difficult to give it up. But anyway, if we are able to change our energy, then we can also give up old habits. And in many ways, uh, this program, the Tridosha balancing program, is probably maybe considered the first step uh, on your journey to making sure that the flow of energy in your body improves. Because if the flow of energy in your body improves, then you will be able to use this energy in ways that can positively impact your life in every way, at every level, whether it's physical, whether it's emotional, mental, whether it's spiritual, whether it's, even socially, and so on and so forth. So it has breathing better has an impact in every area of our lives. We don't breathe because we want to breathe. Do you breathe because you want to breathe? No, you breathe because you have to breathe. It's as simple as that. Uh, shall we get a recording too? Yeah, I'll put the recording, but it's good to be present here because then you get the full benefit of the course. If you watch the videos, chances are your attention will go from here to there, and you may not be able to take maximum benefit from the course. But anyway, yes, I'll share it. So if you improve the quality of your breath, and one of the ways to improve the quality of your breath is to make sure that your systems are cleansed. If you're able to release the buildup of phlegm, mucus, etc., especially in the respiratory system, gradually over time your breathing will improve. Like I said, I damaged myself a lot, and I noticed that my breathing was very labored or every once in a while because of that condition COPD. But breath work kept me going, and I kept going deeper into the power of breath, discovering different things with the blessings of Hanumanji. And now I have a very clear and deep understanding of breath, how it moves through us, and so on. How it can be used to transform us, change us, impact us in many positive ways. Through the insights that I've got, I've used these breathing techniques to heal so many different ailments. You will be surprised. I'll name a few of them. So, COPD, of course, I had this condition, COPD. Uh, every time I visited my doctor, especially in the, say, about last some years, or not last couple of years, but a little before that, especially during the COVID time, etc., my doctor used to say I have to take a thing called, what's it? Pneumonia, a vaccine for pneumonia, which is essential. I have to, and two major injections connected with pneumonia, and a flu shot every year. I said, no, doctor, I'm not going to take any of these vaccines. I do my breath work, I do my breathing techniques that help me expel the phlegm. And today I breathe better than I did even 30 years ago. So there are techniques that have helped me get there, and Tridosha balancing will help you learn some of the basic techniques so that the quality of your breath keeps improving. How much effort, attention, etc., you will put into this depends on you. I can show you the technique, but doing it is in your hands. There's a question from someone. During diaphragmatic breathing, belly breathing, should the abdomen be expanded fully, or is it or is partial expansion sufficient? See, when belly breathing is happening, you don't have to make sure that you take a full 100% full breath into your system. That's not the most important thing at that moment. Belly breathing is something that happens naturally. Sorry. As you breathe in, your breath goes into the lungs. Your lungs are able to expand a little more, push on the diaphragm, and the diaphragm pushes the organs in the belly, or it pushes against them, so that you get the sense that the belly is going outward. So it doesn't have to be done fully each time, but it's a process that should happen naturally without it being a full expansion. When you are doing certain breathwork exercises, if you wish to take a really full breath, do a little kumbhak. That is up to you. That's your choice. You're welcome to do it. But this program is firstly focused on clearing the pathways so that your lungs are able to breathe better, expand better, expel whatever mucus, phlegm, etc., has built up into your system. So that is the main focus as far as this particular course is concerned. Other courses go deeper, but for now, this is our intention. So does anyone have serious phlegm related issues? Hmm? Does anyone have phlegm? What are your phlegm related issues, Neelam?
So I'm having non-stop cold since last 2-3 months, and the phlegm is not expelling, but it's like as I spoke to you the other day, it's constantly stuck in the throat or the nose.
So, again, this is again a matter of the system being clogged up.
Yeah.
Something very interesting happens, which is a molecule called nitric oxide. Our body automatically produces a thing called nitric oxide. When the body, especially when the body is young, it produces a fair amount of nitric oxide. But over time, and doctors estimate after the age of 30, the amount of nitric oxide that is produced in the body just falls. Partly it could be because the systems are clogged. So many people have issues connected with the sinuses, etc. And that is where the nitric oxide is also produced. In fact, a large part of this nitric oxide is produced in the sinuses. And if the sinuses are blocked, that means your body is not able to produce whatever nitric oxide is required or is good for you. And when it's not produced, the vasodilatory effect doesn't happen in the system. So natural vasodilation does not happen. When natural vasodilation doesn't happen, it puts unnecessary pressure on your whole system, cardiovascular system, and other systems, and therefore complications start happening in life, in different organs and so on. So, the more you are able to cleanse and clear your respiratory system, breathe better, and over time, though of course we will not cover this aspect in this course, but this is just for your general knowledge, that there is a thing called nitric oxide that is produced in the body, which helps your body to dilate the vessels. So just keep that as a note somewhere. Right. So belly breathing, I trust you're doing a little bit of belly breathing. Suffering from lungs fibrosis since 24 detected. Virendra Shukla. Huh. So if you are suffering from what happens in fibrosis? The tissue in the lungs becomes stiff, hardened, right? And therefore it's not able to expand as much as it should, right? This is what happens. Am I right, Virendra ji? Anyway, so whatever practices you will learn here and whatever you do here will help you to gradually increase your lung capacity also. So when you notice that, or when you are diagnosed with fibrosis in your lungs, one thing that happens is that your lung capacity reduces. Naturally, when the lung capacity reduces, it means you're not able to take in as much air into your lungs as your body requires it to take. It impacts our physical movement, etc., and so on. So that's the problem as far as fibrosis, etc., is concerned. COPD, like I explained earlier, there is a constant obstruction in the system, and this obstruction is basically phlegm, mucus. This is what causes the obstruction, and therefore breathing is impacted. Right. So please see if belly breathing is happening so that I can share the first part of the course with you. Sorry. Yeah. So please see if belly breathing is happening. Neelam, okay, very good. It's happening.
No, I have a question.
Yeah.
May I ask?
Yeah, please.
What happens to the lymphatic system with this?
Okay. So now the lymphatic system is the system that helps your body to fight anything that is not conducive to the well-being of the body, right? Also, the lymphatic system removes the waste, whatever is like dead cells and so on and so forth. They're removed by the lymphatic system. If the lymphatic system is challenged, if it's not functioning well, you will hear the word immunity. Your immunity tends to go down. When immunity goes down, you will have like constant coughs and colds, for example, or other different kinds of ailments. They can hit your body much more easily than otherwise. So the lymphatic system is like your body's natural system of protecting itself from different ailments and so on and so forth. The lymphatic system also uses different kinds of vessels or vascular system to uh, allow the fluid to go to different parts of the body. For example, if your fingertip has an infection, now your lymphatic system should be able to reach here so that dead cells, etc., which will collect here in the process of healing, can be removed from there. If that doesn't happen, the body will suffer. For example, pus formation may increase, it may lead to more infections, etc., and different kinds of conditions can develop in the body. So the each system in the body, whether it's the lymphatic system, the cardiovascular system, the digestive system, the endocrine system, reproductive system, digestive system, each system has to function well. And if the system has to function well, believe me, your biggest problem is, or the biggest challenge there is any kind of practice which narrows your vessels. Anything that causes narrowing of these vessels will in some way lead to some kind of problem in the body. So being relaxed is your greatest gift to yourself. Just be relaxed. You will be more easily in the parasympathetic nervous system, which is the body's heal and repair system. That is how the body heals, rests, repairs itself. Remember, whenever we fall ill, if we get a nice, good, long night's sleep, we feel much better the next day. Because the body, we may be asleep, but the body is doing its job, healing, repairing, fixing what needs to be fixed. So, the more you are relaxed, the more you learn or allow yourself to be relaxed, the better your systems will function. The better your body will be able to heal and repair itself. Right. So, let's come to the first part of the technique to help us remove phlegm from the body. This what I call the basic course, comprises three different practices which are used to expel the phlegm from the body. And if you are belly breathing, it will happen better. It will happen more effectively. So allow belly breathing to happen. Take a few slow, deep breaths, easy, relaxed breaths, and exhale slowly. In, out. Let your belly expand. In and out. So with belly breathing, you are allowing your system to be ready for the practices that we will do now. Take a slow, full, deep breath. Fill up your body with as much breath as you can. Then you open your mouth and huff. That means you blow out air through the mouth forcibly. You can open your mouth as wide as you like, or the wider the better. So I take a slow, full, deep breath and I go, right? Open your mouth, go. Exhale with a little force. When you exhale with a little force, a certain pressure is there in your body. It pushes on the lungs, etc., to throw out the breath. But what we need to do is take a slow, full, deep breath. And after we do the first half, we don't breathe. We don't breathe in. We wait for a moment. We relax the belly and without breathing in, huff once again. Don't breathe in. Relax the belly. Huff again. Don't breathe in. Relax. Another huff. Then breathe in. So what you do is keep your body relaxed. Keep the stomach especially relaxed. When you do the huff, your stomach tends to push inwards. Therefore, after you do the huff, wait a few moments, let your belly relax, and then without inhaling, a second half. Again, do not inhale.
So we have to, so we have to do it 3 times.
Yeah. So you can do 3 or 4 times as your body allows. Sometimes, if you do it very well, or it's your first time, you may notice that, 3 is probably the maximum you get. But over time, you will notice as your body learns to relax, you can do the huff maybe even more than 3 times. So keep your
Okay.
belly relaxed, take a slow, full, deep breath, and go. Release as much air as you can. Relax the belly. Don't breathe. Huff again. Relax the belly. No breathing. Repeat. 3. Let's try one more time. And yet again. So see, this time I did 5 times.
So we have to
But
keep the spine straight,
yes,
or
if you,
yeah.
no, keep your spine straight, but don't keep it stiff straight. Just a
Okay, got
nice,
it.
gentle. Vajrasan is a great asan to be in to do this. So if you are in Vajrasan, that's wonderful. Try it on your own again without my needing to say it. Now, when you do this a few times, you may notice that there is a little sensation in your throat. So what you can do, what I like to do is I use a handkerchief and I clear my throat. And I keep a spittoon like this. So for hygiene purposes, I put a tissue paper in the container, and then when if any phlegm comes, I dispose of it here so that it's easy to clean. Try it once again. Slow, full, deep breath and repeat huffs 3, 4 times or as much as your body allows.
Because the first time I did, so there was little cough, I spat the phlegm. So now it's
Yes,
feeling better.
that's right. That's right. We'll go deeper. Go deeper. So this particular exercise where you take a slow, full, deep breath as you are belly breathing, do the huff 2, 3, 4 times as much as your body allows without inhaling. So you do the huff, relax your body, relax your belly, huff again without breathing in. So you repeat this 3, 4 times or as much as your body allows. If you feel there is some phlegm coming up, please expel it, please throw it out. Excellent. This part needs to be done 5 times. So do this complete thing, which means each one part needs inhaling fully, doing the huff 3, 4 times, relax your belly each time before you huff, and then take a slow, full, deep breath. So the more relaxed you are, the better it'll happen. Yes, Neelam, you've got your hand raised.
So I don't know about the constriction and constriction in the throat, yes, but two things are happening. Burping is happening, and also when I do the first half and then during the second half, it feels like body automatically minute breath inhale le raha hai. So is it all
It's
right?
okay. It's okay. No. See, what happens naturally in your body, we can't fight that.
Yeah.
But intentionally, we will not take a breath. So you do the half. If a small amount of breath comes in without your doing it, just happens, it's okay. As you continue doing it over time, you will notice that even that can be controlled or it doesn't happen so much. As far as the burping is concerned, I think you and I had a discussion about this. So, so do this thing five repetitions of this. So this is the first part of the huffing technique. Now we come to the second part of the huffing technique. Please do this 5 times, everyone. After you've done it 5 times, tell me. Then we go on to the second part. If there's anything that's not clear, if you have any questions, please ask. I'll explain. Please do it 5 times, then tell me so we can go on to the next step. आप नहीं कर रहे हो प्रशांत? The amount of pressure that you put to do the huff depends on you. If your body, if your health permits you to do a fairly intense huff, that's good. If your body does not allow you, if you're not very comfortable doing a intense huff, you can lower the intensity of the huff, a gentler huff to begin with. As you continue doing it over a period of time, you will find that you are able to do a much more intense huff. Listen to your body, follow your body. You do not need to fight your body, because then you might hurt yourself, you might do something that is not good for your body. So listen to your body, respond and act accordingly. Yes, Nilanjan.
Uh, the exhalation half is fine, but
Hmm.
while inhaling, there is a little thoda sa pain, yeah,
Tightness.
tightness, yeah.
Hmm.
So, am I inhaling more or is it natural?
See, uh, very often this pain kind of a sensation happens because there are certain blockages in our system. Now, the more you are able to relax yourself, the more you are able to be at ease. It'll happen. Sometimes the pain will come and then go away. However, if you feel discomfort, wait for a while. If it still happens, even once you wait, even after waiting for a while, if you still feel that, maybe don't do it now, because mind is a very funny thing, Neelam. If the mind says no, this is causing me problems, it will cause problems. So one of the things is, fighting our own mind, using our mind to be our ally, to be our friend, to be our servant. That's a very big challenge, in life here as well. If the mind all pre-decides something, you've heard of a very interesting thing called what's it called? When a doctor gives you a medication, he,
Placebo.
placebo, the placebo effect. Now, the placebo effect is actually your mind doing its thing. Because your mind believes it's good for you, it's healing you, it will heal. It will heal. Similarly, it works the other way. So the opposite of placebo is nocebo. If the mind gets into the nocebo state, then it can create issues connected with that. But since we cannot fight everything in one day, we take the easy way out. We relax. Okay, mind says no, 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 this is not good for me. Okay, we'll wait. Like we do with a bacha. Bacha, when a child is very insistent about something, you don't fight with him over that for a while. You say, ठीक है, हो गया. And then later you bring in or do as required. So 5 times everyone has done it.
Yes.
Is anyone noticing some expulsion or some movement of phlegm? Is anyone
Yeah, I
noticing
mean,
that? Okay.
yes, I did 3 times.
Okay, very good. Somebody did it. Three. No, you did this 3 times or 5 times? Or
No, no, no,
phlegm came out
no.
3 times? Phlegm.
Phlegm came out 3 times.
Okay, excellent. Very good. So this is the first part. Now the second part is again the same thing, but with a small difference. The difference in the second part, which is also 5 times. So repeat huffs 3, 4 times. Once, that's one. Repeat huffs 3, 4 times. Two. So do the same thing again. But now, as you do the huff, bring your attention to the lowest part of your belly and internally do a gentle squeeze. The first half gentle, second half a little higher. So supposing you do the first half with the squeeze in the lower part of your belly, in the second half the lower part and slightly higher part, so middle, near the lower ribs. In the third half, bring your attention to the upper part of your lungs and intentionally do a squeeze over there, gentle squeeze. We will not do too much because your body may not want to accept that. Yes, Neelam.
Just like we do
With
the
the ha
bandhas,
Sorry.
just like we do the bandhas, that kind of squeeze.
No, 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 no. Bandhas are very different. Bandhas are related to your Muladhar, your
Yeah.
Manipura, and the
navel.
Jalandhar. So we are not doing the bandhas here.
When you say
We
squeeze,
are,
what exactly do you mean?
so, like supposing I want to flex my muscles, I just do this, it tightens. Similarly, if I bring my attention to the lower part of my belly and I do a squeeze internally, you may want to liken it to a bandha if you like, but it's not really a bandha. You just internally tighten your muscles over there. That's all. So start with the lower part of the belly.
Would it be safe to say that squeezing the abdominal muscles inside a little or
No, no,
no?
no. The
No.
abdominal is connected with your Muladhara.
Correct. Then
Oh, sorry. Abdominal. Yeah. Yeah. You can do the abdominal muscle squeeze. Yes. Yeah. Fair enough. Again. So repeat this.
Rajesh, can you please repeat the process, please?
Yes. So take a slow, full deep breath. Relax your belly as much as you can. And then as you do the first half, squeeze intentionally in the lower part of your belly. Relax the belly. Again, half squeeze in the lower and higher part. Again, relax the belly. Bring the squeeze to the chest area. Breathe in. Now,
How does the
intensity of
chest? How does the chest squeezing happen? I'm not able to get that.
आप करके देखिए ना एक बार. Just
मैंने ट्राई
bring
किया
your
तो समझ नहीं आ रहा.
होएगा करके देखिए. As if intentional, जिस तरह से abdomen को squeeze करते, there are muscles all over the body. There are different muscles that work with that. It's like your ribs will push into your lungs. That's the thing, yeah. But do it as much as your body is comfortable handling. So repeat this also 5 times. After you've done it 5 times, let me know.
Sorry to ask again. After the first half and the first squeeze, then we let the abdomen come back to its normal position, and then the second half, then the second squeeze, and then the half, and then it comes to normal, and then again squeeze and again half. Am I correct?
So as you do the first half, you squeeze the lower part of your belly or the belly region. Let's just say
Correct.
belly
Correct.
region.
Correct.
First squeeze. Then you release it. As you do the second squeeze, do the belly and slightly higher. So lower ribs, that area. And
Sir,
then
no, that's
release
not
it.
what I'm asking. I'm asking कि हर एक हाफ के बाद जो स्क्वीज है उसको नॉर्मल होना है एंड देन दोबारा स्क्वीज करके दोबारा हाफ करना है. Am I correct?
Yes, yes. So the squeezing happens as you do the huffing. Now, what happens with the squeezes is different channels, different vessels in your body, including later the lungs. Because, see, we think the lungs are maybe so big, but the lungs have a very large surface area. If you open up the lungs, it's the size of a tennis court. Now, we don't know which part of the lungs have, deposits of phlegm, etc. As we start doing the huffing and the squeezing, we start moving whatever has deposited, collected, or, established itself in a part of the body. And as we do these squeezes, they move. It's not a 1 day process or a 1 minute process, but it's a process. As you continue doing it over a period of time, धीरे धीरे dislodge होते जाएगा, निकलेगा, it will come to the airways, and then you will be able to expel it. My body produces phlegm. I'm aware of that. And uh, I also experiment with techniques which I will share in the advanced course, where you will be able to at least reduce the amount of phlegm that your body is creating through certain techniques. Does it mean that your body will be 100% free of phlegm? Maybe not. Maybe not. But as you go deeper into the processes and use the different techniques, you will find that progressively there is a difference in the quality of your breath if you are self aware. So please do it again. Do the squeezes Repeat it 5 times. Um, After you've done it 5 times, let me know.
Yes, I'm done.
Oh, excellent. Any more flame came out, Samriddhi?
Yes, yes, yes.
Okay, very
Feeling
nice.
better.
Yes, that's right.
I was having irritation in my throat because of the cold, but
Ah,
yeah, I
so
could
as
see, yeah,
Mhm.
a little better now.
Yeah. So as you go through this, the first 3 days of this program, and as you do the practices that you learn over the next over the 3 days, you will notice that you are able to expel a fair amount of phlegm, and that the quality of your breath improves. Over in on the second or third day, I will also show you a technique so that whenever you feel your nose is blocked, whenever you feel that you're having difficulty breathing, if you do that technique, you will find that your breathing improves. So because sometimes, when we have when we've got a cold, etc., and when we go to bed, because the breathing is heavy, we struggle, we turn left, right, etc., but we find it difficult to fall asleep because the breathing is so difficult, the nose is so badly blocked. But you'll find as you do these techniques that your breathing improves.
Okay.
In case I miss out explaining a little more in detail, remind me, Samriti, so that it stays with you.
Sure, sure. Is it like, will it benefit nurturing the other body organs as well? Like liver, kidney?
See, it's so difficult to actually evaluate, how all this is impacting your body. But if you notice anything that blocks, in creates a blockage in the flow of energy, in the flow of these systems, if those blockages are released, there will be an improvement in different parts of your body. What you are
Okay,
doing now, for example, with the squeezes, if nothing else, at least you are creating a little bit of a massage in in your organs. So it's good.
okay.
So
Thank you.
you're welcome. Once you've done it 5 times, please tell me so I can go to the third part.
So
I also
one
feel that
inhalation and multiple exhalations, is it? Like,
Yes, multiple exhalations are important because they help you to release any stale air, etc., in your lungs. Number one.
hmm,
Along with that stale air, if anything is stuck in different parts of your lungs, they start moving. They may not come out immediately, but a movement starts. They start getting dislodged wherever they are. And slowly over time, they'll begin to come out much more easily.
got it.
One inhalation, multiple exhalations is right, Prashant. Yes.
But is it to be practiced every day?
Uh, that's once you've learned it, it'll take you 10 minutes, Samriti. So it's good.
So till the last breath of your life, you have to follow this.
See,
This will be, yeah,
anything you do to improve the quality of your breath will give you rewards throughout the day.
got it.
So,
So the inhalation is happening automatically between the puffs.
yeah, that's similar to what Neelam said. Let the inhalations, if they're happening automatically, there's nothing you can do about it. But over time, as you continue doing these practices, you will find that you'll be able to control even those micro inhalations. So, don't worry about it. But at least consciously don't inhale.
Mhm.
So, once you've done it 5 times, tell me so I can go to the third part. Yeah, ready? Okay. Anyone else done? Anubhav, excellent. Okay. Let's come to the third part. Same thing. Uh, Inhale, keep the belly relaxed. As you do the huff, uh, after each huff, relax the belly so that you are able to do the second half more easily, and then the third half, or maybe the fourth half. Right? Same thing. Now the only difference here is now when you do the huffs, you will bring your attention along the back. So, as you do the first half, bring your attention to the lower part of your back and do a gentle squeeze in the lower part of your back. So, if you like, you can divide your back into three parts: the lowest part, the middle part, and then the upper part. Do the squeezes like you've done along the front, do them along the back. If you do the squeeze along the front and the back together, no harm in that. You can do that as well, because any phlegm that has collected in different parts of your body will begin to move on, because ultimately they will move into your respiratory system in some way and cause blockages and so on. So as you do this, do the squeezes along the back. That's the main focus. Take a slow, full, deep breath. If you like, hold it for a moment, and then as you huff, squeeze in the lower part of your back.
Holding for how many seconds?
A second or 2 seconds is enough.
Okay.
Once again, take a full breath. Do the first half with a squeeze along the lower back. Relax the belly. Wait a moment. Again, squeeze lower part of the back, middle part of the back. Relax. Lower, middle, upper part of the back. So sometimes when you do this, you might get a coughing reflex. Coughing reflex means something from your body, from your lungs, is coming into your airways. So the coughing reflex happens automatically to help you throw out the phlegm. So do this also 5 times. Five repetitions of this as well. Done, Neelam? Excellent. Any phlegm coming up? No?
Kharash in the throat. Ekdam.
That means something needs to come out. So one thing you should add along with all of this, gargle every day.
I'm doing.
Now, so when you gargle, try to use a liquor, tea liquor. Can be black tea, can be green tea. Make a liquor. The water should be fairly warm, reasonably warm, not too much, so that you don't burn your
Liquor
mouth.
as in?
Chai ka pani,
Acha.
with like if you put a tea bag, the 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 tea that's a liquor. There's no milk or sugar in it, just the tea, the brew,
Not salt water.
and a pinch of salt in that as well.
Okay. Okay.
If you
Green
want,
tea or black tea?
you can use either. Both are good. Both
Okay.
are effective. So gargle every morning after you brushed your teeth, etc. Gargle. Uh, Anything that has collected in the throat area will move out much more easily. Whenever we do, even normally, this phlegm tends to collect in the throat, lungs, the sinuses, etc. Gargling helps to move it out. If you do jalneti, wonderful. In your case, Neelam, it'll be even more effective because you feel something in your uh, sinuses. So if you know how to do jalneti, excellent. Even if you don't do it every day, at least 3 times a week, it'll help to clear out that area. Once the cleansing happens, you will find, and I think, at least in the advanced course, I'm going to share some techniques that will help you to increase the amount of nitric oxide in your body. Anyway, I can just mention that anyway. Brahmari is a very good technique that helps to get you that effect. So do this also 5 times. This is the first part of this course. The first part of the first part, let me put it this way. The huffing technique, which includes 3 segments. Just the plain huff. Second half is followed with the squeezes along the front, and the third part is along the back. Each time you do, the first time you do it, in a way you ready your system for more work with the huffs. The second set starts moving phlegm from different parts of the body so that it can come out more easily. And the third part, along the back, you won't understand it now, or maybe you won't understand it now. It'll start helping cleanse your Sushumna Nadi. I will keep using this term, Sushumna Nadi, every once in a while. Uh, think of this as the single most important Nadi in your system. Whenever we catch a cold, etc., there is some blockage in our uh, Sushumna Nadi. This is the Sushumna Nadi wanting to cleanse, to be cleared. Any questions? Are we clear? This part easy, simple for everyone. So do this
Yes.
practice. Please do this practice again tomorrow morning, and we will meet again in the afternoon at 5 p.m. and go on to the second part of this technique. Right?
Okay. Thank you.
Thank you.
Is this like Nadi Shodhan?
I don't call this Nadi Shodhan because Nadi Shodhan is a particular pranayam where you
Okay.
inhale, exhale through both the nostrils. I will use part of Nadi Shodhan on day 3, but you will understand why as we do it. But for the first day, this is what we do, the huffing technique, to help start clearing out as much of phlegm, etc., that we can in the respiratory system. Right?
Thank you so much. God bless you. Thank
Thank
you.
you.
Thank you, Rajesh.
Plus,
Great evening.
remember to gargle in the morning. Thank you. See you
Done.
tomorrow.
Thank you.
Please,
Okay.
please join early so that we can get started early.
Sorry.
Attendance is very low, but well, so be it.
Okay. Thank you.
Right.
Take care. Bye
Thank
bye.
you. Bye. Namaste.